project involves research. The informed consent explains the purpose of the research, as well as the expected duration of the participants' participation. The informed consent must include a description of the procedure to be followed and identification of any procedures that are experimental. Descriptions must be clear and detailed enough for the participants to understand their involvement. A description of any reasonably anticipated risk or discomfort to the participant may experience that has to be displayed. A description of any benefit to the participant or to others that may reasonably result from participation in the study. Disclosures of any appropriate alternative procedures or treatments, if they exist, that may benefit the participant. And it should be a statement describing the extent to which confidentiality or identifying data will be maintained. In the case of research involving more than minimal risk, an explanation as to whether any compensation is involved and whether medical treatment is available if injury is sustained. Identification of whom to contact to answer pertinent questions, to explain participants' rights, or to contact in the event of an emergency. A statement that the participation is voluntary. Refusal to participate will involve no penalty or loss of benefits to which participants is otherwise entitled. The participant may discontinue participation at any time without penalty or loss of benefit. So what are the considerations? It's crucial to consider the participants' specific involvement in the project and the participants' abilities to assure proper informed consent. As with many aspects of the RRB review, this issue must be considered on a case-by-case basis. Regardless of the determination by the RRB, the investigator bears responsibility for assuring the participants have a full understanding of the nature of their involvement in the research throughout the project. And then you have the special population. A special issue in consent arises when participants are unable to give their consent, as is the case in children or cognitively impaired individuals. While they are unable to give legal consent, they may still be able to grasp at least basic aspects of a research project. And when this is the case, assent of the subject is necessary. The RRB will make a final determination as to whether both assent from participants and consent from guardians are necessary. Deception. Many research questions, as has been displayed before, cannot be adequately addressed when full informed consent is required. In many cases, incomplete disclosure or deception is necessary to obtain essential information. This presents a catch-22 in the informed consent process. The RRB will expect an explanation as to the necessity of deception in any project. When it is not possible to answer the research question without deception, the RRB will assess the risk to the participants and make a decision as to what is necessary to protect them. With any research utilizing deception, a thorough debriefing procedure is necessary. The debriefing allows the investigator to explain tactfully what happened and why deception was necessary. Avoid technical jargon. Rephrase in lay terms. Do not include any language that implies the subjects may waive any rights based on their participation in the research. Do attempt to write documents at a 6th grade level. Now, these are a few examples of non-consensual medical experience on human beings, something that is not acceptable anymore. So, How about informed consent in robotics? The conclusion from this article from Surgery from 2013 was to promote informed decision-making and autonomy among patients considering innovative surgery. Surgeons should disclose the procedure's novel nature, potentially unknown risks and benefits, and whether the surgeon would be performing the procedure for the first time. When accurate volumes and outcomes data are available, the surgeon should also discuss these with the patient. So, considerations in new technique. Establishing guidelines for the use of the regulatory ethics paradigm, particularly related to the implementation of new surgical procedures that do not require FDA approval. Recognition of the importance of providing patients with true informed consent about both potential benefits and the complications associated with new surgical technique. The potential pitfalls associated with collaborative relationships with industry and their impact to the patient safety. To begin with, there is an overwhelming assumption by the public that whatever is new must be better. This idea is captured in the ubiquitous use in advertising of the term new and improved. Second, since a recently developed procedure has by definition been performed on a much smaller number of patients than the conventional method, less is known about it. Third, the surgeon should thoughtfully consider whether he or she has taken all appropriate steps to acquire the necessary surgical skills prior to offering them to patients. As part of the consent process, the surgeon must fully disclose to the patient the degree of experience he or she has with the procedure they are considering together. The very fact that the technique is new and that the surgeon's experience with its limits must be explained in the consent procedure. He must ignore the benefits to himself of performing the new procedure and focus only on those for the patient. So, the ethics. We have taken the oath of becoming a doctor. I think you will talk about it. Good. And we should abide to it. So, we do not end up at the Wolf of Wall Street. Thank you for your attention.